Okay, so good evening, everyone, and welcome to Africa Health Insight. Today's edition, we are dedicating to nurses, to patients, and to everybody who is an advocate to patient care. Today, we want to look at a common phenomenon in nursing and healthcare practice, which is trust between nurses and patients or caregivers. Something that we find very common in our hospitals nowadays. And we all can agree that nursing is not all about giving medications, it's not all about greeting patients, but nursing goes beyond what we see superficially. Nursing is all about and the emotions that we attach to it. So nursing is an art, we cannot remove the emotions from it. But in order to do this, as healthcare professionals, as nurses, we need to understand patients. We need to understand that we are dealing with human beings, and then this trusting relationship is going to be built. But we find in most of our hospitals that there is a lot of distrust from patients and caregivers. Why? Because maybe nurses act in a way that patients are not all comfortable with it. I'm sure all of us we have experiences, we have these lived experiences, not just as nurses or healthcare professionals, but also as patients. The fact that we are nurses, the fact that we are healthcare professionals doesn't mean we are not patients, or that we are not going to be patients. So we want to just relate with each other, just to say this is what we observe, this is what we've lived as our experiences, and then all of us we look at how can we make it better. How can a patient come to the hospital with this confidence that this nurse that I'm seeing in front of me, I'm going to put my life onto his or her hands, and I'm going to be safe, because this is what we want. A trusting relationship, a nurse-patient relationship is built on trust. But this trust is something that is difficult to identify, it's difficult to build. So what are those experiences that you've lived, that you felt in your life, that this is what is leading to distrust from patients? So we'll start with Claire. Claire, so you tell us your experience.
Good evening. I am Asan Claire,
Yes.
and I'm a nurse. So far, I've been opportune to work as a nurse for 3 years now, and the experience I've had um, as a nurse relating to patients in general, it's the first point I'll outline. It's the fact of the point of poor communication. This is generally a serious issue when it comes to nurses and patients in general, because most patients usually feel they are not heard, or their complaints are usually being dismissed by nurses, or a lack of adequate information from the nurses to the patient. All this leading to distrust. They tend to feel that the nurses are not competent enough, or they don't know what they are actually doing. Secondly, I will want to also talk about issue of competence. Patients generally perceive lack of confidence and lack of competence in nurses. When you come in front of a patient, you start doing the guesswork in quotes, like, am I supposed to do this? Am I supposed to do this? Am I supposed to do this? To me, I think the nursing field generally has to do with teamwork. If you feel like you're not confident enough in what you're actually doing at the moment, you should seek help from your colleague. Ask questions rather than being in the situation where you not doing the right thing, and then leading to the patient start feeling like this patient does not know this nurse does not know what he or she is doing. This nurse can kill me. This nurse can commit a medical error that will be irreversible. And most importantly, I think one of the reasons why patients feel that nurses, like the disrespect among nurses, is the fact that we have limited number of staffs in according to our institution and our context in our country. We find ourselves in situations where we have 2 nurses on duty to 20 or 30 patients. Trust me, a nurse can never be competent with that amount of patients in front of them. Why? Because they always have emergencies. They are trying to attend to patient A, they are trying to attend to patient B, they are trying to attend to patient C, all at the same time. And all of these conflicting periods leads to incompetence. So to me, I think these points I've listed are basically the reasons why patients feel like nurses are not competent enough and they tend to disrespect them. Thank you.
So much, Claire, for those powerful points. If I got you well, you highlighted the aspects of communication, lack of
Yes.
confidence and competence, and the
Yeah,
problem of staff shortage as one of the factors that lead to mistrust between patients and nurses. I,
exactly.
be- I believe that is an area that we are going to delve into more so as to be able to bring awareness and make sure that our patients receive quality care and we are also respected. So, um, before Giselle, you're a nurse and you have come in contact with patients. Now, I would like to know from you, what are those factors from your own perspective and experience that bring this mistrust between nurses and patients?
Okay, good evening, everyone. Before Giselle, I've been practicing for 3 years. I will start by appreciating everyone, appreciating the first speaker, Claire, on highlighting some points under communication, because when it comes to nursing, communication is the most important thing, because when you communicate to a patient or to a client or a carer very well, you avoid a lot of misunderstanding and a lot of issues. And I want to also highlight on the point of attitude. Attitude. Some of our attitudes are, it's actually really a call for concern, because you see a carer might come complain, give a complaint or point out some certain things, though e falls under communication. Instead of us of addressing the case to a carer or explaining ourselves out, our attitude and the words we turn to, the way our manner of speaking is not really actually the best. And also in the aspect of carelessness, there's a whole lot that can make carers not to trust a nurse when it comes to that aspect. And also punctuality too, because there are some medications that are so like, for instance, I'll talk of like artesunate protocol. Some carers are very sensitive and time conscious, and once the doctor inform them that this medication will be served at this particular time, and when that time reaches and a carer comes to call for a nurse, it's time for my medication, and you get the way some of our responses are not really actually good, which will really make a carer or some patients not to actually trust nurses. Thank you.
Wow. Thank you so much. If I took note of what you said, you highlighted attitude. You highlighted the lack of punctuality from some nurses, which tend to lead to mistrust between nurses and patients. Now, Susan Elvis, yeah, I know. We started by talking about the aspects of nursing. We all have at one point been patient. I would like you to tell us what really brings this misunderstanding between nurses and patients. Why do patients see nurses as a threat, not actually caregivers who wants to come to save them?
Yeah, thank you, Stanley. Let me just share with you guys an experience of a cousin of mine who went to the hospital with a child. So this is a child who had a respiratory tract infection, and then this child was placed on oxygen. So the child was on oxygen for I think 3 days, and the third day of being on oxygen, you know, the child was on oxygen, and then I think it was pipe supplied oxygen. That's oxygen supplied through the walls. And then at one point in time, no, it was use a concentrator. They were delivering oxygen using a concentrator. So at one point in time, oxygen lights went off. So when lights went off, this my cousin went to the nurses station to inform the nurses on duty that there is no light, and she told me that light went off for around 3 minutes. Like they were in darkness for around 3 minutes. This is a child who was in oxygen for 3 minutes. Lights have gone off. She's not seeing any nurse who is coming to check how the situation is going to evolve without oxygen. And then she went to the nurses station to inform the nurses of what is happening, to ask them what is happening and what is the way forward. She told me yesterday that the response that the nurse gave her, even leaving that hospital, unfortunately, or leaving that hospital, and the child finally died, leaving that hospital with that type of mindset. And she told me the nurse asked her if she should come and be the oxygen for the baby. That what should she do? That there's no light. So what should she do? And yes, we can. There's nothing. Let's agree that there's nothing you can do. That there's no light. Won't, like, as a nurse, can you not approach this particular carer? Imagine you are with a child is on oxygen, and then you get to the nurses station. You want to ask them what the way forward in the management of your child, and somebody responds and is asking you if she should change to oxygen for your child. Like, imagine that mindset, that image about that nurse, about that hospital, about nursing, that particular caregiver is going to leave the hospital with. So this is just one example. Another example I've had is a patient is in the ward. This patient is unconscious, and then the patient spends a day. It's in the evening that we discover the patient doesn't have a urinary catheter, and this patient is in a pool of urine. This patient is in a pool of urine, and the patient, like, nurses have been administering medications to this particular patient for continuously 12 hours. But this is a patient who is lying in a pool of urine. Like, how do you expect a carer, even in that unconscious state, that particular patient, if that particular patient had the means to get up from that hospital bed, the patient will actually get up from that hospital bed and go back home? Because you can't be giving me medications to take. I'm unconscious. You are administering medications. Why I'm in the pool of urine? So now when you come and you identify that, okay, this is something that we should have done maybe since morning, but nobody is doing it. Sometimes you even have this resistant culture from the nurses, like they are looking at you like a threat. Like, why do you have to identify that a patient is lying in a pool of urine? And the question is, imagine that you are the patient. How will you feel? What like you even being in the pool of urine as a human being? How does it sound? So those are just some two examples that I wanted to share to tell, like, these are situations that you actually look at nursing and you think, even as a human being, you don't even have trust in your own profession because of what is happening in the profession. Thank you.
Thank you so much, Stephen Elvis. Like those particular situations that you clearly narrated, they they were like they were heart touching, not just to me. Like, because I believe nursing is a profession that is built on ethics. It has a rule of conduct, and when people who are trained to serve others tend to oppress others, then I think that those kind of people are no longer professionals, because professionals are supposed to work within some particular standards. Uh, Kimbi Emil, I would like you to share with us what are some of the things some patients or caregivers do that annoy nurses and tend to provoke them to act in unprofessional manners that bring this mistrust.
Okay, thank you very much, Stanley. I hope I am audible enough for everybody.
You're clear.
Good. Okay. Claire, Giselle, and Evis, thank you so much. Your contributions are really good. I see a lot of things from your direction, and I will still be coming back to it. But before, I want to share with you, before you have a patient in the hospital, there are some concerns that they have. When you have a patient, they have their major concerns. One of those concerns for a patient is about outcome of his or her condition. They want to know. They are very anxious. They want to know. And then most of the times, a patient in the hospital will have that feeling that they are not understood or they are being abandoned. Most of the times, depending on how we interact with them, they will have. And then we have, patients come from diverse cultures and other things too. Take, for example, a Muslim, you have a Muslim and others, it's equally a challenge. Then we have people with language barriers. It's a challenge. We really need to take our time to interact with these people in a way that they don't feel uncomfortable. Sometimes when they are not just being heard, they'll have to act in such a way that you will not be able to cope. You understand? And then there is one pertinent thing amongst all what you said. There is one pertinent thing I equally noticed. Most patients, it's not the first time they are coming to the hospital. They always come with that notion of past experience. There's always a past experience. They'll always share this, especially for those who work at the outpatient department, those who work at the emergency room. I mean, like those who get first contact with their patients. They'll share this experience with you. Like, patients come in and they always have that notion. There is always a notion, a past experience. I have been in this hospital and this is what was done to me. I have been here. This is how I was being attended to, and I will not want that to happen this time around. So already with that mindset, they tend to act in a way that you will, maybe you want to react in a negative manner. But the good thing is this: is as a professional, you don't need to just react so quick. That is why, as a nurse, there are some qualities, there are certain things we need to have. We are supposed to be very keen when it comes to listening. Listening aspect, we are supposed to be very keen at listening, very observant. Very observant. Sometimes the harsh nature of some patients doesn't necessarily portray that they were coming, they have something in mind. It could just be psychological, it could just be anything. You have to be very observant, you have to be very keen in listening to. And then approach. Coming to approach now, looking at what uh, my colleague said about attitude. Giselle said something about attitude. Most at times, we lack composure. Composure. Your presentation, sometimes a patient already has a bad experience about your institution or maybe another health institution coming to you for the first time, and then just looking at your presentation, perhaps dressing attire, perhaps your language, it will play a lot. It will play a lot of their mentality. They will have to come. They will just have to attack. They have to come in a very harsh manner. So composure is equally something that we need to work on. I'm not saying all that nurses are always at fault, but as the master in the game, as a master in the game, you are supposed to play all your possible best to gain your patient's trust. You're supposed to understand them in all aspects. Then always have a good approach to gain their trust. The way you approach your patient, no matter how harsh, no matter, they will always want to calm down and listen. If they believe, if at all they believe they are in the right place and they have the right person, you will gain their trust. They will be able to communicate, and I think management will flow. Thank you.
Thank you so much, Kimbi Emil. Like, if there's one thing I got from what you said, it was about transfer aggression that some patients bring to the hospital or when they want to seek care, because they had a past experience that wasn't good. They feel that coming to you or coming to another healthcare facility, they're going to still experience such kind of treatment or people. So, and you went further to say we need as nurses to be able to understand how patients react and be able to reflect and respond in a holistic manner so as to create a safe and conducive environment that builds trust. So that aspect of transfer aggression is really one that we really need to look into if we must build trust as nurses and patients. I don't know. Label. Please, can you get me?
Yes, I can get you clearly.
Okay, I would like you to share your honest thought with us to one of the possible causes that lead to this mistrust between nurses and patients. What are those particular things that bring this mistrust? We need to look into.
Okay, thank you very much for the question. Okay, before I will, can everybody get me?
Yes.
Okay. Before I'll really go to, I'll start by wanting to first of all maybe give a small introduction as to what these things are about, like patient satisfaction. We discovered that patient satisfaction is defined as the degree of confidence between a patient's expectations of ideal nursing care and their perceptions of real life care. And we see that in our world today, the perceptions that patients have before reaching the hospital is usually very different from what they have after leaving the hospital. So there is always a clash between their expectations and the real life happenings in the hospital. So I can start by saying that one of the reasons is the staffing and the working environment of nurses. Like there's inadequate staffing, like Claire said earlier. So many patients are sent to maybe a ward, like 2 or 3 nurses can be assigned to a ward where you see 20, 30 patients, and maybe all these patients have almost the same time of treatment, or they need care, almost the same kinds of care at particular times. So you discover that if a patient had to take maybe medications at 2 o'clock, before they want to reach where the patient is, maybe let's say the patient is number 30 or something, before they want to reach where the patient is, you will discover that maybe time has gone, and now this patient now has a misconception, like there's lack of competence and there's delay. Now we can also talk of lack of communications. Nurses also sometimes don't know how to properly communicate their action plans, their next plans, or the treatment plans to the patient. Sometimes because they do not have all the knowledge, or sometimes they just feel that it is not necessary for them to actually tell the patient what they have to do. Another one too is poor interpersonal skills. Like some of the nurses appear dismissive and they're always in a rush. For example, let's say in a hospital where you have so many patients, if a patient has to question you on maybe very key or certain things, you might not have the patient to you might not have the patient to explain detailedly what your plan of action is, or how the person should feel, or you might not have all the time to explain what the patient wants to hear. So now that's where there's always that clash between the patient and the nurses. Now we can also talk of inattentiveness, especially at night. These are things that happen especially at night. A patient can be saying this or this, and maybe let's just say for example the nurse is tired and she does not really pay attention to what this patient is saying. Is it that she does not care? No, but she's already tired, or maybe she has some other errand to run. So now it is communicated to the patient like, the nurse no give my time. I dey talk for you, the waka pass like say I need to talk now for you. So you see that now there's always a clash between, these are the small small things where there's always a clash between patients and nurses. Now, are these things intentional? We can't say that intentional, because a nurse can't leave the house to come attend to patients and uh, comes and starts behaving funny. So sometimes you see that these are things that if you don't call to order, the nurse will not even be aware that this is what is happening. Maybe because of the too much workload. So most of these things like that, if we have to retrace it, we'll discover that if there's adequate staffing in a hospital, then I think majority or about 1/4 of our problems between nurses and patients will reduce.
Thank you so much, Elabe. Thank you so much. If there is one thing I picked out from one of the problems you highlighted is interpersonal skills, lack of interpersonal skills among nurses. Um, we uh, we have a Foncham Blissful. Foncham Blissful, please, can you share with us some of the aspects you think that often at times lead to this mistrust between nurses and patients?
Okay, thank you very much for this opportunity to share. Uh, we see that most of us have said one key thing, which is communication. So communication is the most important aspect of being a nurse. We know that with the situation of our country, Cameroon, not everybody came maybe from, you say some people came from art background, others came from science background. But to me, all of those, in a nutshell, the most important part is your practice. If you are able to communicate right, you see that what you, more than what you know about theory, the most important part is your practice. Because as a nurse, you can fasten or heal someone just with your words. There are times that just the hurtful words that you say can fasten a patient's death. And what the healing words that you say are even better than the analgesics that you can give a patient. Just the words of encouragement and so on. I remember there was a certain time there was this health personnel that when the patient, a carer approached the patient. So that was it. The carer approached the nurse and they were like, how is the situation of the patient? I think it was the doctor that answered and they were like, where mommy had this, we don't feel no remedy needed for the situation. With a carer hearing that, it so hurt. That woman had to practically cry out her lungs and we had to comfort her and try to encourage her. As much as the patient may have maybe a heart failure, there is always a way to bring down the words in a way like Maya Mami gave the right part of the card don't feel medication in the way will feel work on that aspect such that Mami people live a healthy life, avoid this chop and so on. So there's always a way that you can pass a message, no matter how severe it is. Even if it is a person on palliative care, there is always a way that you can give that person the energy that the person needs to live, even if it's a few days of the life. And another thing is, one, some of us don't have adequate knowledge. And so, just like one of us said, when a patient approaches you about the medical situation, you are like, when doctor come, I will ask you. Whereas there's some of those things that they are very basic, that is maybe a patient with hyperglycemia that you could just say that where the present level for the blood sugar now 364, but as you are giving medication and insulin and the rest, it will calm down and start to be careful. But you just say where very minimal things that we could explain and let the person know the present situation. Maybe on a night shift, and you tell the person that when doctor will come tomorrow, he will ask you. It seems like you don't even know what you are doing. It makes some of the patients lose trust in us and nurses. Another thing is the lack of confidentiality. When a patient discloses pertinent information about his life to you, that's some that they don't even want even an extended family or even a close carer. Maybe they've told someone just their woman HIV status, and the moment this is disclosed to one or two other family members, they lose trust in who they nurture. It shows that they cannot really entrust their patient in our hands. The next thing is lack of follow-up. When
Hello,
because
hello,
nursing
Concha.
involves community care,
Hello,
as
Concha.
you have
It
to
seems
follow
like
up from the
it seems
vitals
like there
and
is a
checking
background noise. There is a problem coming from your background. There is some kind of
vitally.
noise. There's noise coming from your background. There's noise. There's so much noise coming from your background. I don't know if you can have a check on that. So thank you so much for
Sorry.
your point. One of the areas you talked about was lack of knowledge as one of the main causes of this mistrust between patients and nurses. Um, Now we have all highlighted we have all talked about the problem. What can we do to be able to address this? To be able to boost this trust between nurses and patients? Uh, uh, Asan Claire, you talked about communication, confidence, and lack of uh, staff shortage as one of the factors that
Yeah.
lead to this mistrust. What do you think can be done to be able to reach this gap and enhance trust?
Okay. Thank you for giving me the floor one more time. I think based on the points I raised, I will start off by the first point, which is communication. I think it is important as nurses to always update patients about their current health situations. Like for instance, a patient might come into the hospital with for hypertension, and during the course of management, the patient uh, 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 gets another illness because of her healthcare, sorry, her environment, like malaria, and you just go ahead as a doctor. The doctor requests for treatment and for lab tests and discover, okay, this patient has acquired malaria from the hospital. That's like a nosocomial. As a you nurses just start acting like robots. Doctor don't say my buy the medicine. Give. You don't explain to that patient that, okay, you came from your house without malaria, and because of our poor healthcare facilities, you now contracted malaria, and we'll be managing you for this. Updating the patient about their health situation is very important. Giving active listening to them actively during a conversation when they come and lay in their complaints, it's very crucial. It's very crucial for them, because most patients usually feel like they are not being heard. Like for instance, I'll keep talking about the problem of uh, uh, a lot of patients related the patient ratio to the nurse. Now we find ourselves in a healthcare system where you have two nurses to 30 patients, and obviously a nurse will be tired, and a carer comes and like, I want to a patient comes like, I want to know more about my situation, please can you explain? I'll explain tomorrow. Or when the doctor comes, the doctor will explain to you, that's not my domain. I'm not supposed to explain. Even though you're not supposed to explain some detailed things to that patient, because you may not say it as you're supposed to say, it is important you use words that can calm down that situation as of that moment. Let the patient feel comfortable and feel that, okay, what this nurse is saying is actually true, and this nurse know what he or she is doing. Now, I'll talk about the issue of competence. It's true. One of my the co-speakers here mentioned that some people left from the arts background, left from the commercial. I, for one, I left from the commercial background, but I believe constant studying, constant attending seminars and other programs that can further educate you about attending to patients, attending to carers, and even things that can assist you in the society. Now, in some health facilities, they usually organize refresher courses. When I was a student, I did internship at the Santa District Hospital, and that's one thing I really admire there. There they do refresher courses every Thursday, and it's compulsory for all staffs and students. Now they bring in a topic, they explain the topic and how different patients react to different treatments, how nurses react to the patients, and how patients react back to the nurses. That way, it reduces the gap between the patient and the nurse. And also, lastly, the last point I mentioned was issue of the shortage of staff. Trust me, that's the one of the biggest problems we have as nurses in Cameroon. And if I can't really say much about that because it is a system in quotes, but want to say, if the government can look into this and try to provide solutions, because there are a lot of nursing students who are graduating from school every year. For instance, institutions like the Catholic institution, National Polytechnic University Institute, St. Louis, and so on. They keep graduating students every year, thousands and thousands of them. But then they're in the streets doing call box and other stuff. Whereas if the government if the government can provide employment for these nurses, it's going to reduce that gap between the patient and nurses. That way, we're going to have quality care. Thank you.
Thank you so much, Claire. Like you shared a lot that we really need to look into deeply. We really need to look. You talked about communication, not just communicating. We need to communicate clearly, effectively, and timely. And
Yeah.
you mentioned of the problem of nursing shortage. It's not about that, not about the quantity. It's about the problem of retention and assimilation. And you
Yeah.
have made mention that for this problem to be solved, the stakeholders in the position, they need to create an atmosphere where they assimilate this stuff. And you equally talk about competence, where you said whether you're from the arts, the science, or the commercial background, we need to focus in accumulating that knowledge, in accepting that gap and going in for advanced studies,
Yeah.
professional development. And you highlighted some very some particular facilities that are doing that, and that is why we are here at African Health Insight to always bridge this gap, to encourage and to improve outcomes. Um, Emil Kimbi, you talked about something, transfer aggression from patient to nurses, which is one factor that brings mistrust between these people. What do you think can be done in simple terms to be able to address this problem?
Okay, thank you once more for the opportunity to talk again. Yeah, aggression or past experience is quite a big show in this particular discussion that we have. And I don't think we have much. It will still bridge. If you notice, almost all the points always boils down to communication. It means communication carries a bigger role in everything that we are saying today. And then I mentioned approach. If most at times we can always give them the floor to talk, air their minds, so that we know exactly from where their problem or where their anger is actually arising, you will be able to approach them well, and you will be able to calm situations, and you have things done the right way. So it's still communication. But as the discussion has been going, I equally noticed something pertinent about pertinent information. Blissful, we talked about pertinent information, and I equally want to relate it with what Claire said about explaining or telling the carers at least what is happening, how management was. Now, I begin to figure out who, apart from the patient and the nurse, there is equally an intermediate, which is the patient carer. It is the patient carer. So, if you look at things, it is not actually, most of the times, the issue is not even with the patient themselves, but sometimes the issue is between the patient and the carer, the nurse and the carer. The nurse and the carer will be the ones having the issue here. And this will always come up because sometimes the person that is chosen as a carer might not just be the person that you want to be communicating almost every necessary information with. Some of these persons are usually so sensitive about things, and they want just one specific information. Most at times, they critically ill, they want to get specific things just to know what they want, and then you know how they begin to go about spreading the news or saying whatever they want to say. But it's usually a challenge. It's very a challenge when you have a carer who is not necessarily supposed to get all in that care. He's not supposed to have all. I've seen situations like not long, I think a week back or so, I think I received a carer who came in very eager to know, like, what is the situation? I haven't heard anything. It is just the first day of coming in, and then he has never been there. And he is not directly, like, he doesn't really have a bloodline. He was like, I am the pastor to this patient. I need to know everything about this patient. It's not good. I have been here, I've not seen anything done, just the first day of visit. And then you begin to wonder, you had the carer before and you have been communicating with the carer. knowing fully well that information will be passed on to whoever later on. And then you need to see other people coming in. I am this, I am that. And we know very well we don't share information that way. We don't share information in that manner. We can't share. So this third party is equal like a big issue here. To manage a third party, you have your patient, you have the nurse, but now a third party in between is usually so difficult. In the beginning, once you have a case where you are supposed to always work with the carer, it's always good to know who is responsible, who will remain by the side of the patient, who will be able to communicate with you and the rest of the family, because you cannot dish out information to everybody. Today, Mr. A comes, you talk with Mr. A. Tomorrow, Mr. B will come in, and he equally wants information. And the truth is, sometimes, even if you have to do it that way, which is not correct, if you have to do it that way and you transmit to Mr. A and then you give the same information to Mr. B, when the two parties meet, they won't have the same information. There will still be a breach, because sometimes not everything that you tell, I don't believe everything you tell Bliss to hear and you tell me, and then you ask us to transmit that information, it won't go the same. There will be some lapses there. So it's a challenge. Early enough, it's always good to detect. That's why we talk about being observant in the beginning, and then taking the best approach. You must be professional. Take the best approach. Know who to communicate with from the start. Yes.
Wow. Thank you, Emi Kimbi. Your points are really, really, really valid, and I believe they are going to go a long way to create awareness. You talked about the aspect of communication, adding to what Claire said, and in what you elaborated, I came to understand that empathy is very important, and trying to counsel patient carers is equally very important to build that trust between a patient and a nurse. So, Stephen Elvis, you shared a situation of your family member going to seek guidance from a nurse, and the nurse giving the feedback in a harsh manner. What do you think, in brief, can be done to be able to build this patient nurse relationship, despite the fact that the nurse might be tired or the patient might have used some aggressive words to be able to seek care from the nurse? What do you think can be done to address this?
Seriously speaking, Stanley, and to the those who have been able to contribute up to this point, I think we need to start identifying the problem where it is found. We all can agree that this problem is not just the problem that is a static problem or a problem that comes up once in a time. This is something that we all witness, we all live on our, like, daily in Cameroon. We live this. And to be frank with you, this problem, we have to start looking at the training that we are giving nurses and other healthcare professionals. Because when all of us, we are trained, we have the knowledge. But I think there is something very crucial that is lacking in the job market. And that crucial thing that lacks are the skills. The skills, we lack the skills, not just the technical skills, but we lack those skills of interpersonal skills, communication, leadership. These are skills that you gain through experience. These are skills that, and this is a gap in our training, because our training doesn't incorporate this holistic approach into nursing training or into the training of healthcare professionals. Maybe we'll come one day to discuss about the relationship that exists between nurses and most importantly medical doctors. But I can tell you that the problem is embedded deep into the roots of where we are coming from. It starts from the training that they give us. Because if we have this training, we have this an environment where we learn these basic skills, critical reasoning skills, ethical reasoning skills. So many of us will not go to the hospital to work on patients. We'll go to the hospital to work on human beings, to work with human beings. But when people start having the mindset that they are working on patients, not on human beings, that's why you see most people are concerned about the technical skills. And even the technical skills that you see is all about maybe giving the patients medications. Sometimes people give patients medications that if you ask what the side effects of those medications are, nobody is going to tell you, nobody is going to tell the patient. So it's not, I don't think it's about what we have at present. Is about where we are coming from. Why is this trend a normality in our hospitals? Why is it normalized? And if we started from gaining these skills, then we can begin to look at our level, our hospitals. Means that we have to look at our systems. We have to look at the processes in the various hospitals, professional processes, clinical processes. Are there protocols that are put into place that ensures respect for patients, those values that incorporate into nursing practice? That when I see a patient, I'm going to deal with this patient as a human being. If you go to most hospitals, you'll discover that this hospital do not have a way of life. And the fact that they don't have a way of life means any other nurse is going to come with his or her own way of life. And that's why patients will come, they will experience all forms of ways of lives, because there's no unique way of life of a particular institution. So if there's a way of life which is embedded into the values that are defined in each particular hospital, everybody is going to fit in. You're going to fit in into the values. You're going to fit in into the belief system of a hospital. And nobody is going to come in with his or her own way of life and begin to deal with patients as if they are not human beings. So this is a kind of multi-complex problem that we cannot just isolate these problems that we find in our hospitals, but we have to look at it from a more broader perspective, looking at the training, looking at the processes in our hospitals, the systems in place, and then we can now begin to say, okay, if there is these processes are existing, there is a system that everyone knows, and this system is full of values and a belief system that the patient is at the core, then I'm sure we'll do away with all this. And one most important thing that all of you have highlighted that I also wanted to talk a little bit on is this concept of patient-centered care. I think when we talk of patient-centered care, it looks a little bit abstract in our minds, but how do we operationalize patient-centered care? How do we take care of people who are at the center of the care that we give? If you have to take care of me and I'm at the center of the care you are giving me, then I have to contribute fully to the care that you give me. But in most of our hospitals, you see that it's about a pastor preaching in church. It's about a priest preaching. It's about an imam preaching. It means that we do and the patients accept. So the patients are not able to contribute into those processes that we are establishing. Even when you look at when we set into our hospitals, when we set audit committees, how many of those committees involve patients into them? Because if you are setting up a committee in the hospital that needs to talk about me, then I have to be part of that committee. If you set a committee in the hospital that have to decide about me and I'm not part of it, how am I contributing into aspects that involve me? So I'm not going to talk a lot on this, but I think those are basic things that we need to start talking about. Patients and clients and caregivers, they need to be part of these processes. They need to be part of the system. When we are part of the system, we contribute to the system. You don't expect me to, as an outsider, to contribute to a system. And if I am a beneficiary of what you do, then I have to be part of it. I have to contribute to what you produce. I think this is all I have to say in line with the way forward. All others have pinpointed so many aspects that we need to look at to be able to ensure that This trusting relationship between nurses and patients and caregiver is a trusting relationship that enhance maximum patient care. So once more, thank you all for your contribution.
Thank you so much, Susan Elvis, for your powerful contribution. When you were sharing, I I saw the definition of nursing as according to the new concept brought in by the International Council of Nurses, which is about inclusivity, which is about access, like being accessible to the patient, being accessible to those factors that bring maximum care and respect to the patient. And all that you said, I can see that it all touches that particular definition. And we as nurses, we must learn to embrace this holistic care, holistic training, if we must uphold and give quality care to our patients. Thank you so much. Before Giselle, one of the aspects that brings mistrust, according to you, was punctuality. In brief, oh, she's gone. Um, okay, Fonchan Blissful. In brief words, can you give us one of some points that can be used to be able to build more trust between patients and nurses?
Okay, thank you very much. I think one of the things that can bring trust between nurses and patients is we have highlighted adequate staffing, should communicate widely. I think they should also be adequate equipment. This one I think will also go to the some of our hospital administration. I think like staff we can also communicate at our own level through those that are ahead of us, like our ward charges or those that are ahead of us. Because there are sometimes we really want to give this care. Maybe a patient needs an oxygen concentrator and there are just two in the unit. And you have 3 or 4 of such cases desaturating, and they may not necessarily meet the level of pure oxygen that would take them to the reanimation, but now the equipment are not available. So yes, inadequate equipment is one of the problems that if the equipment are provided more, it will solve some of these problems. Like even the back wheels and some of these things, they are very necessary. Another aspect is documentation. After communication, I think one of the key things in nursing care is documentation. Sometimes we can actually give the right care. Maybe there were actually major things that you did in the life of a patient that you fail to put them down, and your shift ends and you go home. The next shift enters and you don't know the last glycemia of that patient. You maybe probably check the blood pressure twice, but you recorded just one value. So if we can also improve in our documentation, it will breach some of these problems. At least the colleague who is taking over from you knows where to start, like where you ended and where to start from, and also hand over. Many a times, because sometimes, like someone mentioned, punctuality, maybe because colleagues come late, you take over and you're just in a haste to go home. We fail to properly hand over the patient, and so those who are taking over from us, they don't know the end. Maybe that patient they left in a good state, but at the end of the shift that patient was not in the best state, and before they want to reach the treatment time attending to that patient, the patient already has a severe hypotension. That we even see cases where patients die without the nurse even know. You just discover a patient and you don't even know what to write as a death note because where there was no proper handover. So documentation, proper handover, and we should also do close follow up because we need also baseline information. The way a patient came and the current situation, we should be able to compare This patient came with a BP of 160 something, though it's at 164 now, but it looks like a normal blood pressure to other patients. But for this patient, this is not how the blood pressure was on admission. And so we should be able to do these follow-ups. And I think, yes, even holistic care also involve the nurse not only basing herself in drug administration, vital signs, but we may have to extend, maybe there's a lacking lab result that needs to be followed up for that patient's state to improve, and it's been lacking for 2 days. If you opt as a nurse to follow up where those results are from, right from the lab, bring it to the ward, is followed up, and a problem that was discovered about that patient is solved, and it is communicated to this patient, the patient will have more trust in you because they feel that you are actually so concerned about their situation. Thank you.
Thank you so much, Poncham Blissful. Your points are really powerful. I believe as we are on the healthcare policymakers watching us, and they're going to take some of our points into consideration to be able to make change. And that is why we are here. You talked about documentation, which is really, really very important, because a nurse who is acting without information is just like a soldier without a general. So it's very important that we document well and have a baseline to be able to care for patients. Because if we don't have a baseline, we will just act casually, and they will not be confident, and that can bring mistrust between patients and nurses. Thank you so much. Before Giselle, you talked about punctuality, respecting time of medication administration, which is which is very important. In brief, can you tell us how this can be improved to boost nurse patient relationship and trust?
Thank you so much, Mr. Stanley. The first thing I would like to talk on is Mr. Elvis mentioned earlier on, highlighted so many things and clear too as well. So the first thing I would like to talk on is being time conscious as a nurse. You didn't just get up and found yourself in the hospital working as a nurse. At least you went through some training, and through that training you acquire some knowledge, ethics. And Elvis earlier mentioned that some problems we are facing in our hospitals now with nurses is didn't just start in the hospital, but it started at the level of training. So when the training school don't actually train the nurses well, they pushes the work into the hospital administration. And when these people, these nurses get into the hospital, it is now left for the hospital to train these nurses, giving them the proper knowledge on how the administration, or on how a lot of things are supposed to be handled or functioned in that institution. Claire spoke about organizing a lot of healthcare training on how to enhance patient-carer relationship. We have to understand that as nurses, we are called to act, and not giving a patient medications on time, you are indirectly killing that patient. You are indirectly killing the patient. So it's now left for the hospital administration to organize seminar, train our nurses, train us, give us more training. And in the aspect of late coming as well, our word charges, our measures, because I don't think it's all the time that the hospital administrators might be present.
So
Giselle,
before Giselle comes back, I just want to say our secret word is competence. So I repeat again, our secret word is competence. So maybe Giselle can continue. I don't know if
her connection seems like it's disturbing her, but Giselle said we need to improve on professional development. We need to incorporate holistic training, like Steven Elvis highlighted. It's very crucial if we have to build competent and skillful nurses. Labelle talked about interpersonal skills, which is something that is very important as far as building relationship. Labelle, can you tell us in brief how can this be improved to be able to develop more trust between nurses and patients?
Okay. When I spoke of interpersonal skills, I made mention of the fact that some of the nurses appear dismissive. Some of them are always in a rush. Then some of them are always in the midst of having or giving a patient's drug. They are conversing about their personal affairs with the other nurse. But now, how can we improve this? If a patient presents a problem to you, maybe complaining of one thing or the other, even if you have explained to the person or to the patient in question, I think taking out few minutes or few seconds to re-explain or to reassure the patient on what their worry is will go a long way into creating calmness and reduce tension and friction between the patient and the nurse. In as much as during the course of the day,
so. Guys, we want to thank you again for coming. The discussions were very insightful. We appreciate your contributions, your inputs, and I'm sure uh, every other person listening, whether you are a patient, you are a caregiver, you are a nurse, there are a lot of things that we've said that will benefit everybody here. There are a lot of things that will benefit our patients. There are a lot of things that will benefit our population. But all in all, what we want to say is that as nurses, as healthcare professionals, we need to take the bull by the horn to say that we are dealing with human beings, and in front of you is not a patient, it is a human being. And by so doing, every other person is going to have this trust that we so crave. And this trust can only be built if we are confident, if we are competent, if we communicate well, and if we give a listening ear to those who come to our hospitals. So once more, I want to thank you all for coming. Until then.
Okay,
So
thank you,
guys, sorry,
Yeah.
I had to stop. I had to stop the. Wait.